And action. Taz had a question about what to do with her symptoms. Symptoms of cough, cold, sore throat, ears being plugged up, drippy nose, all that stuff. And truthfully, although some of you might have more of a sinus congestion, fullness, and pain, some might have ear fullness and crackling, some might have sore throat, some might just be coughing or any combination of those things. To me, it would be all upper respiratory tract infection, anything from the chest up. And it's typical for this time of year. Springtime is when the sun starts to give you longer days. We get tempted to go outside. It's still a little chilly, so sometimes there is an issue with getting outside, being exposed to cold, and having your immune system still recover from the winter. So it sets you up for an infection. The fact that you have an infection doesn't say anything about your immunity unless you're repetitively sick, but it just says that we have to deal with some symptoms. So the Western medicine way to do things is to see if there's anything that we can find. A junky sounding chest, a productive greenish discharge in the nose, a fever, if a red ear, a red throat. If we can find that in the office, then we'll treat it. Usually it's antibiotics. And I think I'd use antibiotics this way. My contention is that if you have a fever, you're infected. If you have an infection and it's less than 5 days, usually I'll say it's a virus. If you have it greater than 5 days, the likelihood is your immune system's compromised, it's more of a bacteria. Viruses under 5 days don't really need antibiotics, unless it's influenza. If we have symptoms of influenza, if we have a community that's suffering from influenza, if we have an outbreak and you have the same symptoms, I'll go ahead and treat. Don't even have to get that nasal swab. And that's usually with antivirals. They work great for certain viruses. If you have a bacteria though, and the only way to tell is to kind of make an educated guess and get some tests done to look for nasty things like sinus congestion with a CT or chest x-ray with a pneumonia. You need antibiotics, and if you take antivirals when you have a bacterial infection, it does nothing. You just waste a lot of money. If you don't take any antibiotics and you have 10 days, 5 days or more of infection, you might be able to beat that with hoping you have a good immunity. I like to use my favorite, which would be astragalus, red reishi mushroom, quercetin, sometimes elderberry or other supportive things like increasing fluids. I usually use, although the studies have said airborne doesn't really help, I use it to at least flavor my fluids. I can take more of them faster, more volume faster. Lozenges for throat infection and or cough, over-the-counter mucus breakers, and then if it's just a sore throat, I'll use a throat spray, immune support. I don't have that with me today, but those are the things I do conservatively, and it's not going to hurt. I mean, you just have to do it, and hopefully your immune system recovers quick and fights what it has to fight. If it can't, and or you are a caregiver for somebody that's elderly or young kids, or you're a teacher, or you're a healthcare professional where you're going to be possibly exposing other people to what you have, then you might bite the bullet and take an antibiotic. If you're suffering, no question. If it's bad, go ahead and take an antibiotic. I mean, worst case scenario is if it was truly a virus and you take an antibiotic, again, the opposite way, you'll be wasting money and you'll be taking an antibiotic that will kill all that good bacteria in you. By the way, if you're on an antibiotic, always get on a probiotic for at least 30 to 60 days. And then maybe you can consider stopping. I take one every day of the year, but that's up to you. And if you don't respond, you got to get in for evaluation to see what's going on. When we have anybody that has those symptoms, again, you take your conservative treatment with over-the-counter stuff or herbal stuff. You might add into the recipe of treatment antibiotics. As far as which antibiotic, it does make a difference. If you have community-acquired pneumonia, there's a certain family of antibiotics that helps more so than others for that type of bacteria. If you have a bacterial infection from, say, you working in a hospital or you're exposed to somebody elderly, then there's a certain bunch of antibiotics that help and kill those bacteria faster. So it's pretty much it's a decision-making process. Even if you have been on certain antibiotics in the past, it's sometimes helpful to have a doctor kind of figure out which choice you should be on And truthfully, if it is a bacterial infection that's spreading throughout the community, sometimes a track record of that bacteria in particular will kind of show with previous patients how it responds fastest. So it takes experience to figure out if everybody is taking Z-Pak and it's not killing the bacteria and they're needing to get on second round of antibiotics. And you live in the same area, I'd probably not take Z-Pak even if it worked for you before. It's certainly convenient, it's 5 days, but if it's not going to help you, why even bother? So those are all important. I usually say you can take care of this via the portal, the advocate portal, or sometimes just triaging and hearing about symptoms. I don't like taking antibiotics. In fact, I haven't taken an antibiotic in about 7 years. I rely on the stuff I just showed you. And I've only been sick, at least about a month ago I was sick, where I couldn't speak anymore and I had to take off. But it's important to speak or facilitate or compress the time frame of healing. So if you're going to be sick and do it naturally and holistically, but it's going to be a month, you'll be exposing everybody around you to that infection while you're trying to take care of it. So that's not fair. If you have disease, HIV, hepatitis, asthma, if you're on a rheumatoid medicine, you want to really compress the infection fast. So bottom line is that if you have a certain protocol or an algorithm set by you and your doctor, you probably get better faster instead of a guessing game. And just be careful when you are sick, whether it's a virus, less than 5 days, or it's a bacteria, I usually in general say more than 5 days, you'll still be contagious. So watch those around you. No kissing, no handshaking, no high fives, transfer of pens, pencils, stuff like that. Be careful. I think hand sanitizer is great. I think soap and water is better because of the fact that hand sanitizer has some bad stuff in it, but it does kill bacteria. And then watching your activities, decreasing your exercise by about 30%, and then getting really good rest, in addition to watching and avoiding certain foods. Even if you're okay with milk, I usually say try to avoid the heavy stuff, milk, alcohol, the spicy foods, large volumes of foods while you're sick. That just takes a lot of energy away from the immune system and puts it into the digestive system when you don't need that right now. So Taz, hopefully you get better fast. Good question.